Hello, my name's Erica and I'm going to be your nurse. Today I'm going to be doing a head to toe assessment. First, I'm going to begin with a general survey. You appear to be well nourished, you're not under or overweight, your mood appears to be pleasant, and your posture is appropriate. And I would obtain a set of vitals and height and weight at this time. So throughout the exam, I will be assessing the skin for color, temperature, and note any lesions or edema that might be present. So at this point, I'm going to inspect the shape and the size of the head, which appears to be symmetrical. The ears are even with the eyes. Facial features also appear to be symmetrical. There's no facial drooping. And now I'm going to palpate the head for any masses that might be present. Was there any tenderness? And now the ears. Any tenderness? The skin behind the ears appear to be normal. There aren't any lesions. And now the TMJ. Can you open and close your mouth? Good. I'm not feeling any grinding or crepitus. Temporal pulses, one at a time. And they feel equal, about +2. Next, I'm going to palpate the lymph nodes in the head and the neck area. We'll start with the preauricular, postauricular, occipital, submental, submandibular, jugulo-digastric, superficial cervical. Tilt your head for me so I can feel the deep cervical chain. And now tilt the other way. Posterior cervical and supraclavicular. Was there any tenderness? Next, I'm going to move on to your neck, checking range of motion and muscle strength. Flex your head forward and extend up to the ceiling. Rotate to the left and to the right. Tilt your head to the left and to the right. And back to the left. I'm going to apply a little counter pressure to assess muscle strength. Good. Range of motion appears to be equal bilaterally. Now I'm going to look at your eyes. They appear to be symmetrical. Pupils look normal, about 4 millimeters bilaterally. Now I'm going to use my pen light. Alignment of the eye appears to be normal. Constriction of the pupils is brisk. The sclera appears to be white with blood vessels. Corneas are moist and transparent. And the lower conjunctiva is moist without drainage. Now I'm going to ask that you stare at my pen light and follow it with your eyes as we go through range of motion, keeping your head straight. Good. The eyes are moving smoothly. There's no nystagmus. Next, I'm going to use my pen light to inspect the structures of the mouth. Soft palate arches appear soft and symmetrical. The uvula is midline. Teeth and gums appear normal, no swelling or bleeding. Now stick your tongue out and say ah. Good. And the tongue is midline and arches are rising symmetrically. Now I'm going to inspect the internal nose. Nasal membranes are pink and moist. I'm going to palpate the nose now, as well as the frontal and maxillary sinuses. Was there any tenderness? Now I'm going to step around to the back to palpate the thyroid gland. And tilt your head to the right. I'm displacing the trachea to feel the thyroid. And now to the left. And hold your head straight. Can you swallow? Good. I don't feel any enlargement. Next, I'm going to inspect the thorax. Can you turn around to the back for me? The shape is elliptical. Shoulders and scapula appear to be symmetrical. The anterior, posterior to transverse diameter is normal, about 1:2 ratio. There doesn't seem to be any difficulty with breathing. Can you tilt your head down for me? I'm going to feel all the sinus processes from the cervical area all the way down to the lumbar area. And I'm going to feel the paravertebral muscles on the way back up. Any tenderness? I'm also going to percuss over the costovertebral angle at this time for any kidney tenderness. Any tenderness? Good. Next, I'm going to listen to breath sounds. Just breathe in and out for me a little deeper than you normally would. And I'm also listening to the lateral lobes. Good. Good. Lung sounds clear and equal bilaterally. You can go ahead and turn back around to face the front for me. Now I'm going to inspect the chest. Shoulders and clavicles appear to be symmetrical. Doesn't seem to be any difficulty with breathing. I'm going to listen to the breath sounds again. Just breathe in and out a little deeper than normal. And I'm listening to the lateral lobes as well. Good. Lungs sound clear and equal bilaterally. Next, I'm going to listen to heart sounds with the diaphragm of my stethoscope, starting with the aortic area. S2 is louder. And the pulmonic area, S2 is still louder. Erb's point, S1 and S2 are about equal here. Tricuspid area, S1 is louder. And the mitral area, S1 is still louder. The apical pulse is also heard here, so I would count the heartbeat for a full minute. And now I'm going to listen for any murmurs in these same areas with the bell of my stethoscope. Good. I don't hear anything. I'm going to finish by listening over the carotid for any bruits. This is heard from narrowing or blockage of the vessel. So hold your breath for me and take a breath and hold again. Good. I don't hear anything. Now I'm going to inspect the arms. Can you hold them out for me? Now turn them over. They appear to be symmetrical. No muscle atrophy, swelling, or edema. Capillary refill is normal, about 2 seconds. And the skin feels warm to the touch. Next, I'm going to inspect and palpate the shoulders. I don't see any swelling, and I don't feel any excessive warmth. Is there any tenderness? Now I will assess range of motion. Can you flex your arms up and extend them down? Now hyperextend them back. Good. And abduct your arms out and up. Now adduct them in and cross them. And can you rotate them internally behind your head and externally behind your back? Good. I didn't notice any limitations. Was there any pain or tenderness during those movements? Now for strength, I'm going to put some downward pressure on your shoulders, and I just want you to shrug them for me. Good. Now I'm going to inspect and palpate the elbows. I don't see any swelling, and I don't feel any excessive warmth. Was there any tenderness? Now I will assess range of motion. Can you flex your arms and extend them? And can you supinate and pronate? Now for strength, I want you to flex with resistance and extend with resistance. Good. Next, I'm going to inspect and palpate the wrists. I don't see any swelling, and I don't feel any excessive warmth. Is there any tenderness? And now the hand and the joints of the fingers. I don't see any swelling. Now I will assess range of motion. Can you flex down and extend up? And hold your elbows still. And can you medial deviate towards each other and then lateral deviate away from each other? Now for strength, I want you to push down against my hands and pull up. And for the fingers, can you abduct and adduct into a fist? Good. And flex and extend. And now for strength, I'm just going to have you squeeze my hand. Good. There didn't appear to be any limitations, and strength was equal bilaterally. Now I'm going to palpate the axillary lymph nodes, central nodes in the center of the armpit, pectoral nodes along the anterior fold of the axilla, subscapular nodes along the posterior fold, and the lateral nodes on the underside of the upper arm. And I don't feel any lymph nodes, which is good. They're only felt when they're enlarged. And at this point, I'm going to educate my patient how to complete a self-breast exam And yes, even men can get breast cancer. The breast should be inspected monthly for symmetry, paying close attention to any changes in size, shape, or skin condition. And palpate every inch of the breast tissue, paying close attention to any lumps that may be present. Now go ahead and lie down. I'm going to inspect the abdomen. It appears to be symmetrical among all 4 quadrants. And I'm going to listen to bowel sounds with my stethoscope. And they're present in all 4 quadrants. And with the bell of my stethoscope, I'm going to listen for any bruits in the abdominal vessels, starting with the abdominal aorta, right and left renal arteries, right and left iliac arteries, and right and left femoral arteries. Good. Now I'm going to palpate the abdominal aorta. It's anterior and it's not widened. Next, I'm going to palpate all 4 quadrants for any masses. Do you feel any tenderness? And now skin turgor. Has a quick rebound, so good. Now onto the lower extremities. They appear to be symmetrical, no muscle atrophy, swelling, or edema, and the skin feels warm to the touch. Capillary refill is normal, about 2 seconds. And while I'm down here, I'm going to palpate pedal pulses. We'll start with the dorsalis pedis and the posterior tibial. Good. Next, I'm going to inspect and palpate the hip joint. I don't see any swelling or feel any excessive warmth. Do you have any tenderness? Now I will assess range of motion. Can you flex your leg up and extend it back down? Good. And abduct your leg out to the side and adduct it back in and cross over the other. And bend your leg up. Can you do internal rotation and external rotation? Good. I didn't notice any limitations. Was there any pain or tenderness during those movements? Now for strength, I want you to flex your leg up against resistance and extend back down against resistance. The strength seems to be equal bilaterally. Now I'm going to inspect and palpate the knee joint. I don't see any swelling or feel any excessive warmth. Is there any tenderness? Now I will assess range of motion. I'm going to have you bring your leg up, and can you flex and extend? And now for strength, I want you to flex with resistance and extend with resistance. Good. Next, I'm going to inspect and palpate the ankles. I don't see any swelling or feel any excessive warmth. Is there any tenderness? And now the feet and the joints of the toes. And I don't see any swelling or feel any abnormalities. Now I will assess range of motion of the ankle. Can you plantar flex your toes towards me and dorsiflex your toes back towards you? Can you invert so your soles are towards each other? And eversion with your soles away from each other. Now for strength, I want you to push your toes towards me with resistance and back towards you with resistance. And flex your toes down and fan them out. Good. There didn't appear to be any limitations and strength was equal bilaterally. Now point your toes for me, and I'm going to sharply dorsiflex your foot backwards. Is there any pain in your calf when I do that? Good. So negative Hohmann sign. Now for coordination, I'm going to ask you to run your heel down your shin from top to bottom without falling off. Good. And I'm going to have you differentiate between sharp and dull. Do you feel this sharp and this dull? Okay, now go ahead and close your eyes for me. Do you feel this sharp or dull? And this? And this? Good. You can go ahead and sit up now. And I didn't notice any difficulty with you changing positions, so that's good. I'm going to ask you to hold both of your hands out for me and close your eyes. And I'm going to place an object in your right hand, and I'm going to ask you to identify the object with your right hand only. Good. And with your left hand, same thing. Okay, you can go ahead and open your eyes. Next, I'm going to have you hold both of your arms out to the side. And can you touch your right finger to your nose and your left and alternate them back and forth? Now with your eyes closed. Okay, good. Now I'm going to ask you to stand up with your back towards me. I'm looking at the curvature of the spine, which appears to be normal. There's no scoliosis present. Next, I will assess range of motion of the spine. So with your hips stabilized, can you flex forward and touch your toes and extend back upright? And can you rotate to the left and to the right? Now bend laterally to the left and to the right. Okay, good. I didn't notice any limitations. Was there any pain or tenderness during those movements? Okay, and we do not assess strength of the spine. Next, I'm going to assess strength of the lower extremities and balance. So I'm going to have you walk like you're walking a tightrope, so heel to toe and heel to toe. Good. And last, I'm going to assess balance and position. So I'm going to ask you to stand with your feet together and your arms down at your sides with your eyes closed. And I'm looking for any loss of balance. Minimal swaying is okay. Okay, good. It doesn't appear as though you're having any difficulty with that. So that completes the end of our head to toe assessment, and I want to thank you for your participation.